Before we get to today's show, I wanted to share a quick reminder that being financially organized is one of the biggest factors in building wealth. Want to be a millionaire? It's not going to happen if you're not organized with your money. So, how can you get organized? Well, our favorite app is Empower. It's free, allows you to connect your banks and brokers, and it gives you daily income and expense updates. Ready to try it out? You can sign up at thecollegeinvestor.com/empowermoney. Hey there, welcome to the College Investor Audio Show, and this is an interesting topic we're going to discuss today. Unions are suing to block student loan rule that caps nursing and social work borrowing at $100,000. Very interesting today. We'll get to it in just a second, but a quick reminder, anytime you hear a podcast, there's an article right along with it. You can dive deeper on the discussion at thecollegeinvestor.com. Also, like, follow, and all the clicky things you do on social media so you can get to know us, ask questions, whatever you want. We'd love to help you along wherever you are in your money journey. Type in the words The College Investor on socials. You'll find us. Okay, let's take a look at this union suing a coalition of 4 major unions. I don't think I'd need to go into all of the different acronyms and how long they're major. Okay, they filed a lawsuit on August 11th of this year in the U.S. District Court for the District of Columbia, challenging the Department of Education's Reimagining and Improving Student Education, or RISE rule, on setting graduate versus professional student loan limits. The complaint asks the court to vacate the rule's definition of what a professional student is, which is the definition that determines whether a graduate can access $50,000 per year and $200,000 total in federal loans, or just $20,500 per year and $100,000 total. So basically just attacking the professional student caps. The unions collectively represent millions of workers. These are nurses, teachers, social workers, librarians, public health employees, which the new rules classify as non-professional for student loan borrowing purposes. By the way, they're not saying that you're not a professional at what you do. Anyway, okay. So here's why it matters. The One Big Beautiful Bill Act eliminated Grad Plus loans and created kind of a 2-tier graduate borrowing system that took effect July 1st. Congress defined professional student, again, not demeaning in any way, by pointing to an existing regulation, 34 CFR 668.2 if you want to look it up, which used a 3-part functional test and a non-exhaustive list of 10 example degrees. The RISE rule converted that open-ended test into a closed list of 11 programs, adding clinical psychology, layered on doctoral level, 6-year licensure, CIP code requirements, excluded advanced nursing, MSN and DNP, education, social work, public health, library science, occupational therapy, physical therapy, physician assistant programs, among many others. Okay. A separate lawsuit challenging the rule has already forced the department to at least temporarily expand the list of qualifying degrees, and they added 29 new degrees to that original list of 11. So for students in the excluded fields, that means half the annual borrowing limit and a potential gap that private lenders are expected to fill on worse terms with loans that carry no federal protections and never qualify for public service loan forgiveness. The complaint notes that more than 80,000 public comments were filed on the proposed rule, and roughly 97% objected. Here are the legal arguments. The complaint brings 7 claims under the Administrative Procedure Act, which fall into 3 buckets. The first bucket, the professional student definition is unlawful. The statute set an open-ended functional test with illustrative examples, but the final rule swapped in a fixed 11-program list, required licensure as a universal prerequisite, and leaned on CIP codes that NCES itself disclaimed as a regulatory device. So the unions are arguing this conflicts with the statute, exceeds the department's authority, and is arbitrary and a little bit capricious. Number 2, or the second bucket, I should say, the grandfathering carve-out was narrowed illegally. The statute exempts anyone enrolled in a program and borrowing as of June 30th for their expected time to credential up to 3 years. The rule actually strips that protection from students who transfer schools, even in the same program, or temporarily withdraw and re-enroll. The third bucket, the rule took effect a year too early. The Higher Education Act's master calendar requires loan program rules to be published by November 1st to take effect the following July. The RISE rule was published May 1st of 26 and made effective July 1st, 26, which the unions say means it couldn't lawfully apply before July 1st of 2027. That last claim isn't really that simple, though. The Higher Education Act gives the Secretary authority to designate rules for early implementation, and the department actually argues Congress itself waived the calendar by requiring the loan cap provisions to take effect July 1st of 26. This is the third major challenge to the new loan limits. This is the third major lawsuit targeting the caps and the professional degree definition. A coalition of 23 state attorneys general sued earlier this year, and a union representing physician assistants was actually successful in getting a preliminary injunction that blocked part of the definition on June 24th, just days before those caps were supposed to hit. The DOE responded by temporarily expanding the degree list to 29 programs, then updated the list again to add more nursing and psychology programs. But the unions point out the expanded list exists only for the duration of the court's stay. It still excludes critical degrees like social work, public health, library science, and education master's degrees. And it comes with no explanation of the criteria the department actually used for this. All right, let's connect the dots here and then wrap up for today. The stakes are biggest in healthcare, really, where new loan limits are already reshaping graduate nursing programs that routinely cost more than $100K graduate cap. So this also has significant impacts in education and social work, too, where some states require a master's degree to even work in these professions. Congress has taken notice. A proposed House bill would classify graduate nursing as a professional degree by statute, which would double borrowing limits for those students regardless of how the litigation even ends. As this moves forward, just watch out for the department's response and any motion for a preliminary injunction. Plus, whether this case lands alongside the nurse practitioner litigation already before the D.C. federal courts. In the meantime, though, the expanded 29 program list is in effect while the existing court stay lasts, so students in excluded fields should plan around those lower caps in the future, unless a court says otherwise. Just plan for it, just in case. And you can follow along on this case, find out more, get all the resources and links we talked about today at the College Investor. Type in the words of the podcast, the title, right into the search bar. It'll take you right to the article where you can see all the info, the case documents, and everything. You can also like and subscribe and everything on social media so you can talk to us directly. Just type in the words The College Investor and you'll find us. Thanks so much for stopping by today, and we'll talk to you again real soon.